So when we think about gum recession, one of the things I always tell patients is I really want them to think about it as having loss of bone in the area. It's a bone recession that's occurring. The gums are simply supported by the bone that's around the teeth, and so if we see root exposure on a tooth, we've actually lost bone and the gum has fallen down in that area. The other thing that we oftentimes have to think about is the characteristics of the gum tissue that we have receded into. Thicker or bound down tissues have less tendency to break down than thinner and loose and movable tissues. Thinner and loose and movable tissues don't seal themselves to the bone. If the seal is not there, you have a higher tendency for the bone to want to break down in that area. A lot of this is actually genetic. The shape of your jawbone is genetically influenced. The characteristic of your gum tissue, it's the loose and movable tissue. If that's what's up against the next of the teeth, that's genetic. There's a lot of people who feel that gum recession is only caused by aggressive brushing, which certainly can influence it, but it's not only caused by that. And I oftentimes tell patients that they don't necessarily have to blame themselves for something like the gum recession that's occurring. Sometimes they can blame their parents. So if we leave gum recession untreated, especially when we've receded down into the loose and movable tissue, we have a higher potential that you're going to have continued loss of bone support on the teeth. If you have continued loss of bone support on the teeth and continued recession, you have a higher risk of developing decay on the root surfaces of the teeth. Sometimes there's sensitivity for patients. You have cosmetic issues for some people. You ever heard the term long in the tooth? Well, long in the tooth used to mean we're getting old, but really what they were talking about was gum recession. So when a patient has gum recession, there's certain things that we're looking to do. Sometimes we're looking to treat sensitivity or cosmetics. Sometimes we're looking to just gain thicker tissue so that the recession and the bone loss doesn't continue in those areas. So we have a variety of treatment options that are available for the patient who has gum recession. They range from what we call a surface graft or a free gingival graft, which is simply meant to try and give thicker tissue. We have connective tissue grafting, which is a procedure that oftentimes allows us to cover roots back up, and over the course of time you'd be very hard pressed to ever tell any recession ever occurred in an area. We do grafting with what we term cadaver tissues or allograft type tissues, and then we have a procedure called the pinhole surgical technique that allows us to reposition the gum tissue down over the roots of the teeth and use some collagen strips to help bulk up the area, similar to what we would get with a grafting procedure sometimes. In our office, we have many different techniques for treating gum recession. We treat each patient different based on their particular presentation and what they need in their case.